Okay, here's part 2 of my rant about recovery, Suboxone, and people that are in it. Also, I struggle majorly with depression and anxiety, bipolar disorder. It's a very hard life, and let me tell you, when you're on Suboxone, doctors that do not know it or have never experienced a withdrawal in their life, but yet they tell us, this, that, and the other, you know, it's terrifying. But some of the doctors that got on medicine, I know a couple that used to be my doctors, and they got on medication, and now they relate well with patients because they know what we go through when we go through withdrawal. It really sucks. It's so terrifying for me, and it's terrifying, I'm sure, for everyone that has the same issue. So I just wanted to take some of the stigma off of it, because we really get treated, we get treated like shit anywhere we go, in a pharmacy, a doctor's office. Like, if you have a regular health issue and you go into a doctor's office, they see that you are on Suboxone, they automatically assume you're there trying to seek drugs, you're there for this and that, and you don't get a good diagnosis. I've yet to find a doctor that has not treated me that way. So I want, also pharmacists, they do it as well. Like, we're just pieces of crap, move them in, move them out. Some of the recovery offices I've been to, luckily not the one I have now, but the ones beforehand, only cared about the money, no recovery, no nothing. And it's a uphill battle. It really is. And the way we're treated in general and by other people, and just the word addict, people are gonna look down and be like, you're this, you're that. It's ridiculous. It's very hard. But you guys, follow me, like these videos, and comment below if there's any type of discussion that we could have, about this issue, because it's getting just to a point where we need to take the stigma off of it, and doctors need to understand, and other people, that we are not, in the sense of the word addict. We need to take the stigma off that word, because there's a ton of it, and they think if you're an addict, you live under a bridge, use dirty needles, do this, do that, you ain't got a home, you don't have anything. But being a recovering addict is very hard, and it is not like that. There are a lot of addicts that are out there living like that, but they're not in recovery, so I don't know. I think it's just something that we need to talk about more. So thanks for watching, guys. I really appreciate it. And again, please hit that follow button and like this video. Thank you.